Hi there, I'm Dr. Rich Murphy, the Director of the Institute for International Studies. Here at the Institute, one of the things we do a lot of is what we call therapeutic tutoring. And we get parents all the time asking us, what is therapeutic tutoring and how is that different than other types of tutoring? Well, regular tutoring, the type you would get in most places, deals with the question of what to teach the child. In other words, where are they falling behind and what needs to be done to help that child catch up. Therapeutic tutoring focuses on a very different question, and that is, why isn't the child learning like they should? Now, a lot of the children that come to our tutoring center are not your typical child who's maybe doing well in school and has one or two subjects are a little behind. They're not the lazy children that just don't care about school. The children that come to our tutoring center are children who need some special help. We're focused on helping children with the learning process, children that are struggling with that learning process. This is especially true of children with ADD, dyslexia, and ADHD. Now, these children think differently than other children. I want to get this clear. There's nothing wrong with these children. They're not defective, but they think differently. They're right-brain children thinking in a left-brain classroom. And a lot of people try and say, well, there's something wrong with the child. No, it's just that there's something wrong with the classroom. The classroom is not set up for that child. So what we try and do is help the child train their brain to function in the classroom. And of course, that will help them later in life. Take a look at this graphic. This is called the Learning Continuum. Now, you see there's 5 levels here going from the bottom to the top. And these levels are actually steps that a child goes through. Now, I've drawn a line here, and if you look above that line, you see the schools focus on basic academic skills. That's reading, writing, math, spelling, geography, all that stuff that you learn in school. And then that boils down to what we call the academic content. So that's really where the school is focused on, is getting that academic content to the children. They are operating under the assumption that the children have already learned the lower level skills that are below that line, which allow them to learn. So let's start from the bottom and work our way up, okay? We have the core learning skills. This is developing auditory, visual, and motor skills. It's internal organization of the brain, and it's body and attention awareness. A lot of children learn this very early in life. This is a lot of what they go through in those first 5 years of life. Those are necessary skills for a child to be able to think normally and learn normally. But some children don't have those. Okay, I wear glasses. If I take my glasses off, I have a visual problem. I have a core learning skill. I cannot make my eyes function in such a way that I can see clearly. So there's no way I can process the information correctly. Now we go up to the next level, we have the processing skills. This is what the brain does with these things that we get down on that core learning skills level. This is dealing with memory, attention, auditory and visual processing. In other words, taking what they see and understanding, or taking what they hear and understanding, extracting information out of it, and the speed at which children can process that information. And then we get up to what's called the executive function skills. This is strategy, organization, self-regulation. These are the things the school is assuming a child knows when they come so that they can start working on academic skills. A lot of children have struggles in these areas, and this is where we focus. We focus on helping children overcome these areas so that they can go on into the academic area. This is what therapeutic tutoring is all about. Now, depending on the child, we may need to work on a combination of these core learning skills. Processing skills and executive functioning skills. They can be strong in one area of their life and weak in another area. We have some children that have visual processing disorder. We have other children that have auditory processing disorder. Well, just because a child has one of those doesn't mean they have the other. They may function at a very high level in one of those and very low level in the other. And so we need to understand where they are and work on a combination of skills. Through our evaluation process, we determine where each child's specific needs are. That's why the evaluation is so important. Then we custom tailor their tutoring plan to strengthen the areas where they are struggling. This isn't a short-term solution. We're not just trying to get them through their homework. We're not just trying to get them caught up. We're trying to come up with a long-term solution to their specific problems and their specific needs. That's what we're about. We're trying to help that child overcome. Now, both of my wife and I have had to overcome in our lives. I'm dyslexic. And I had to learn to overcome. My wife has ADD. She had to learn to overcome. We're both successful in our lives. You can be successful with these conditions, but you need to learn how to be successful. That's what we're trying to help them do. We use a variety of different methods, combining academic work, physical movement, and cognitive exercises to train and exercise the child's brain. The results of these methods is to help the child learn to think and process information more effectively. Basically, what we're trying to do is teach them how to think for themselves. And these results will stay throughout their lives. They aren't just academic skills to get them through school. No, these are skills they're going to need once they get out of school, once they get in the workplace. These are skills that will help them maximize their own potential in their own lives. That's what we're trying to do here at the Institute for International Studies. And if you think your child has some needs in this area, we'd love to talk to you, give you a free consultation, what we can do for your child, and if they need it, give them that evaluation. So please give us a call. We'd love to talk to you, and we'd love to help your child reach their potential. Thank you.